Hello viewers, welcome to the Learners Nursing classes. It has been long that we have not taken multiple choice questions for the exams. Now the exam NORCET is coming and this exam will give employment to so many nursing officers. So let us go through the multiple choice questions which are important and which have come in the previous exams. So let us start. The causative agent of Lyme disease is Rickettsia prowazekii, alpha virus, Borrelia burgdorferi and Trypanosoma brucei. See now what is the causative agent of Lyme disease. What is a Lyme disease? देखो Lyme disease is a disease which is caused by the bacteria and it is a disease which is vector borne. Vector borne means जब आपको कोई insect bite करता है और वो insect इस बैक्टीरिया या वायरस को कैरी करता है तो these are called as vector borne diseases. So in that the Lyme disease is the vector borne disease. Now इसमें होता क्या है, rash and bulle pattern like bullseye pattern of rash will be coming, flu like symptoms will be there, joint pain, fever, malaise and there are symptoms like chills. So the tick-borne infection is it is a tick-borne infection. So what can be the right answer? The right answer is Borrelia burgdorferi. Now, which among the following is the sign of severe dehydration among infants? Infants का मतलब होता है बच्चा जो 1 साल से छोटा है उसको कहते हैं infants. Now, what can be the signs of severe dehydration? Anxiety and increased skin turgor, drowsiness, depressed fontanelle and decreased skin turgor, excessive crying and excessive thirst, drowsiness, bulging fontanelle and decreased skin turgor. So here you see the answer will be drowsiness, depressed fontanelle and decreased skin turgor. इसमें बच्चा ड्राउजी होने लग जाता है, बच्चा इतना एग्जॉस्ट हो चुका होता है और इतना थक चुका होता है कि बच्चा ड्राउजी होने लग जाता है, इतना डिहाइड्रेटेड होता है. जो फॉन्टनेल्स हैं स्पेशली दी एंटीरियर फॉन्टनेल वो अंदर को संकन होगा, डिप्रेस्ड होगा एंड द स्किन टर्गर विल बी डिक्रीजिंग. मतलब कि रिकॉइलिंग ऑफ स्किन दैट जो अगर आप देखोगे स्किन टर्गर बहुत ही पुअर होगा, डिक्रीज्ड होगा. So here the answer is drowsiness, depressed fontanelle and decreased skin turgor. Which options describes orthopnea? Orthopnea का मतलब क्या होता है? For that we should know what is orthopnea. So ability to breathe only in upright sitting or standing position, slow breathing, difficulty in breathing, rhythmic, waxing and waning of respiration. So here the orthopnea means the ability to breathe only in the upright position or sitting position or the standing position. The obstetrical assessment of the following reveals this is her 3rd pregnancy. Now we have to do the obstetrical assessment based on the data given below. Now this is her 3rd pregnancy. Her first child was delivered at the 38 weeks of gestation, that means term. Her second child was delivered at 34 weeks, that means preterm. Now calculate the GTPAL score. Now to calculate this we should know what is GTPAL score. So here the G stands for gravidity like gravida 1, gravida 2, then T stands for the term, P stands for the preterm, A stands for the abortion and L stands for the living issue. Now abortion means any abortion before 20 weeks of gestation. So now let's come to the answer. Now it is written 31101, 31102, 31111, 32111. Now I'll tell you what is the right answer. The answer is 31102. That is the second option. Now how I'll tell you. See, this patient is gravida 3 because this is the 3rd pregnancy. This is her 3rd pregnancy. Then comes term. She had 1 term, that is 38 weeks, 1 term pregnancy. Then comes preterm. She had 1 preterm delivery, that is 34 weeks. Abortion. She had 0 abortion and presently she is having 2 live issues because the death of the child is not mentioned in the figure. So this becomes G3, T1, P1, A0, L2. So here the right answer is option 2. Patient arrived at emergency department after a road traffic accident. The pulse rate is 127 beat per minute. Blood pressure is 90/56 with cold extremities. Nurse understands that the patient is at risk of which type of shock. See, pulse is high and BP is low and the extremities are cold. So, neurogenic shock, hypovolemic shock, spinal shock, cardiogenic shock. Now, patient arrives in the emergency department after a road traffic accident. So, what kind of shock we are expecting? After a road traffic accident, patient may had a fracture, patient may had a head injury or internal bleeding. So we may expect the patient will have hypovolemic shock. Contraindication of liver biopsy is diabetic condition of the patient, decreased activated partial thromboplastin clotting time, increased activated partial thromboplastin clotting time, and immunocompromised patient. So here the answer is increased activated partial thromboplastin clotting time. Now in which what happens is there is a bleeding disorder and the bleeding will not stop. So you cannot take a liver biopsy because liver is such a vascular organ. Whenever we take a biopsy, true cut biopsy or open biopsy, the liver will bleed and the bleeding cannot be stopped because of the increased activated partial thromboplastin clotting time. The most preferred site of administration of intramuscular injection in children under 1 year of age, that is infant, is dorsogluteal site, vastus lateralis, ventrogluteal site and deltoid site. See, gluteal is never preferred in infants and deltoid is also never preferred in infants. So the site which is preferred is vastus lateralis. The mask shown in the image is known as, if you could see, there is a mask with a reservoir bag and a tubing. Now in this image, the mask which is shown is nebulization mask, simple facial mask, non-rebreather mask, venturi mask. So this is a non-rebreather mask. When the serum bilirubin level rises on the 3rd and the 4th day after the birth of the baby due to inefficient hepatic function, it is known as pathological jaundice, obstructed jaundice, physiological jaundice or viral hepatitis. So we are talking about a newborn baby. The serum bilirubin rises initially and by the 5th day it starts declining. So this type of jaundice is called as physiological jaundice. Which of the following drug is prescribed to an antenatal mother for the fetal lung maturity? Whenever any antenatal mother is there, जिसका preterm baby होने वाला है या we are expecting early delivery, what kind of steroids we give or lung maturity के लिए the drug we give is a steroid, which is options are bromocriptine, metoprolol, betamethasone, metoclopramide. So here the answer is injection betamethasone is given at the interval of 12 hours. For example, if we give one first dose at 10 p.m., the next dose will be given at 10 a.m. next day, and so the 2 doses are given at the gap of 12 hours. Now if the patient is coming when we are expecting that she may deliver and the baby is expected to be preterm, we try to give steroid to the patient as the patient arrives. So whatever the patient has come, patient will arrive and the gynecologist or the pediatrician, they are discuss the case and then they advise to give betamethasone, which is given stat, and after 12 hours repeat. This helps in the lung maturity of the baby, preterm baby. Which of the following medication is administered sublingually for managing angina pectoris? See, angina pectoris means, angina means pain and pectoris means pectoralis muscle of the heart. So here which drug is given sublingually? Sublingually का मतलब होता है जीभ के नीचे रखना, lingual मतलब tongue and sub मतलब उसके नीचे. So the options are aspirin, betalol, nitroglycerin, warfarin. So here the answer is nitroglycerin. We always give nitroglycerin sublingually to relieve angina pectoris because nitroglycerin is a vasodilator and it dilates the coronary vessels and relieve the pain in the angina, and angina pectoralis is relieved. The reference point of the measurement of the jugular venous pressure is suprasternal notch, sternal angle, xiphisternum and the nipple. See here the options which are given are suprasternal notch, sternal angle, xiphisternum and nipple. The phlebostatic axis is the point where we are supposed to see the JVP, measurement of that JVP pressure. So the answer is sternal angle. If a nurse evaluates the ECG and sees a saw-toothed P wave, what will be the diagnosis then? See, saw-toothed P wave are a classical diagnosis of a pattern of an ECG. The options are atrial flutter, premature junctional complications, atrial fibrillation, nasal arrhythmias. Now here the answer is atrial flutter. These are the seesaw shaped structures which are coming in the ECG, which are representative of atrial flutter. Non-stress test is said to be normal if there is, now NST, non-stress test is done in an antenatal mother to check the fetal heart rate, acceleration and deceleration. So here the options are 2 or more FHR, that is fetal heart rate acceleration during a 20-minute period, 2 or more FHR acceleration in 40 minutes period, no deceleration during a 40-minute observation, no disacceleration during a 40-minute observation. So here the question is, non-stress test is said to be normal if there are 2 or more fetal heart rate acceleration during a 20-minute period. Apical pulse can be assessed at, see apical pulse, a doctor has to see the apical pulse ki where it is a locate or auscultate. How? At the second intercostal space in the left mid-clavicular line, between 2 and the third intercostal space in the left mid-clavicular line, between the fourth and the fifth intercostal space in the left mid-clavicular line, or between the fifth and the sixth intercostal space in the left mid-clavicular line. So here the answer is fifth and the sixth, between fifth and sixth intercostal space in the mid-clavicular line, but in case of pediatric they will see fourth and fifth rib, between the fourth and the fifth rib. So in adults it is fifth and the sixth intercostal space in the mid-clavicular line. What should be the ideal ratio of cardiac compression and respiration during CPR in a child? So there are many options, 3:1, 15:2, 15:1 and 1:1. Very diplomatic question. There is so much of confusion, adult, pediatric, infant. But here the answer is the chest compression and respiration will be 15 compression and 2 respiration, 15:2. Which of the following is not included in the surgical safety checklist? Now I have taken a topic, surgical safety checklist. You can go back to that. Surgical safety checklist is a very important topic, and it is only a presentation or a topic of 5 to 10 minutes. One can hear that and know that very important points are there. These are legal, medico-legal points, and one should know. Which of the following is not included in the surgical safety checklist? Verify with the patient name procedure to be done. Allergic check, medication check, counseling. So what all is done in the surgical safety checklist and what all is not done? So I'll tell you. Counseling is not included in surgical safety checklist. The surgical safety checklist have the verification of patient, name, procedure and side, allergic test and medication check. But the counseling is not part of the surgical safety checklist. Which solution should be used to mop up the spilled blood on the floor of operation theatre? A very important question, very commonly performed, very practical. So the solutions are Sidex, that is glutaraldehyde, sodium hypochlorite solution, Savlon, that is citramide, and formalin, that are formalin solution, which is used for the storage of the specimens. So here the answer is sodium hypochlorite. Identify the post-renal cause of acute renal failure. So what are the post-renal causes of acute renal failure? Benign prostatic hyperplasia, acute glomerulonephritis, heart failure, antihypertensive medication. Answer is benign prostatic hyperplasia. The reason for polyuria is best defined as lack of urine formation, diminished ability of the kidneys to concentrate the urine, passing too much of urine at night, dark colored urine. Here the answer is diminished ability of the kidneys to concentrate the urine. The question is, reason of polyuria is the best defined as diminished ability of the kidneys to concentrate the urine. ECG given below is off. If you see the ECG, have an observation on this. It is off. atrial fibrillation, atrial flutter, sinus tachycardia and PSVT. See, in sinus tachycardia there will be tachycardia, the heart rate will be high. In PSVT also there will be ventricular tachycardia, and so heart rate will be high, and it is paroxysmal supraventricular tachycardia. And atrial flutter, we read about it, that in flutter there will be saw shaped structures, whereas in atrial fibrillation the heart will fibrillate. You see, if you see the interval is altered, so atrial fibrillation seems like that when the RR intervals are very distant and close, and there is no air, it's very going odd, it's not going even. So here the answer is atrial fibrillation. Most common symptoms of alcohol withdrawal is rhinorrhea, body ache, tremor, diarrhea. Here the answer is tremor. Weber test is done to diagnose eye problem, hearing loss, respiratory problem, cardiac problem. Here the answer is hearing loss. What is mandatory before glucose tolerance test? See, what is important is nil by mouth 8 to 10 hours prior to test, rich carbohydrate diet from 2 to 3 days before the test, stop giving medication, and no need to change anything. Here the answer is nil by mouth 8 to 10 hours prior to test. Hand rubbing time for alcohol based hand washing is 10 to 15 seconds, 15 to 30 seconds, 30 to 45 seconds, or 60 seconds. Here the answer is 15 to 30 seconds. Identify the given image below. Now there will be an image. See, look at the image. Tinea corporis, bed sore, steam burn, or flame burn. So here the answer is tinea corporis. See, it is circular, it has got inflamed tissue, it has got some bacterial infection. So it is like tinea corporis exactly looks like this. Gastric lavage is a procedure done to wash or irrigate the stomach, urinary bladder, rectum, or urethra. Here the answer is stomach. See, gastric lavage. Gastric lavage itself says that it is gastric word is used for stomach. Which fluid causes shifting of the fluid from cell to plasma? Which fluid causes shifting of fluid from the cell to the plasma? See, hypotonic solution, isotonic solution, alkaline solution, hypertonic solution. So here the answer is hypertonic solution. What are the benefits of kangaroo mother care? It maintains temperature, it is helpful in breastfeeding, it increases the affinity between mother and the baby, and all above. So here the answer is all above. The kangaroo mother care will maintain the body temperature of the baby, because baby is in direct contact with the mother or the father, where the baby is given as a kangaroo mother care. It's helpful in breastfeeding also, because it will create a nice bond between the mother and the child, the baby, and it is helpful in breastfeeding. It increases the affinity between mother and the baby, and sense of belongingness of the mother towards the baby increases. So answer is all above. Vidal test is done in the diagnosis of rheumatic fever, hay fever, enteric fever, dengue fever. Here the answer is enteric fever. Enteric fever means typhoid fever. Which of the following electrolyte imbalance is associated with digoxin toxicity? Hypokalemia, hypernatremia, hyponatremia, and hypocalcemia. See, here it is written hypokalemia, hypernatremia, and there are some spelling mistakes, hypercalcemia, and I'll tell you the right answer is hypokalemia. Hypokalemia means there is less potassium, decreased potassium. The infant has undergone VP shunt, that is ventriculoperitoneal shunt surgical procedure. On the assessment, how will you assess the sign of increased intracranial pressure? ICP means intracranial pressure. See, the infant has undergone VP shunt, that is a ventriculoperitoneal shunt, means there is a pipe which is connected from the ventricles of the brain to the peritoneal cavity, and the excessive CSF is drained from this pipe or the tubing through the shunt. The shunt is made from the ventricles to the peritoneum. So now how will you assess that there is increased sign of ICP, that is intracranial pressure? respiration, blood pressure, anterior fontanelle assessment, and urine output. So here the answer is anterior fontanelle assessment, because here we are talking about an infant which has got fontanelle open. Parkland formula for the fluid calculation in burns patient is 4 ml into body surface area of burn into weight, 3 ml, 2 ml, 1 ml. So here the answer is Parkland formula stands for 4 ml of the body surface area burned into weight, and then it is further divided into 8 and 16 hours, क्योंकि 8 plus 16 is equal to 24 hours. So whatever fluid which is calculated out of this is divided first 8 hours and then rest 16 hours, it is given like that. Intermittent positive pressure breathing is contraindicated in comatose patient, pulmonary edema, asthma, tracheoesophageal fistula. So intermittent positive pressure ventilation is contraindicated in tracheoesophageal fistula. Endogenous depression is also known as autonomous depression, reactive depression, bipolar depression, unipolar depression. So here the answer is autonomous depression. What is the ideal position during a lumbar puncture? The lateral recumbent position with knees flexed, the supine position, the lateral position with extra pillows under the head, or the Fowler's position. See, in these positions, knees flexed is important. So lateral recumbent position with the knees flexed. So that will be the position for the lumbar puncture or the spinal anesthesia. Give the correct order of 5 stages of dying person. Anger, depression, bargaining, denial, acceptance. Denial, depression, bargaining, anger, acceptance. Depression, denial, anger, bargaining, acceptance. Denial, anger, bargaining, depression, acceptance. Here the answer is denial, anger, bargaining, depression, acceptance. What is the name of the outer lip-like structure that protects the entrance to the female reproductive system, the female genitalia? Here we are talking about the female genitalia. Hymen, labia, cervix, none of above. See, labia is the structure which is outer lip-like structure which protects the entrance of the female genitalia. Which condition is defined as the inflammation of peritoneum? Duodenitis, colitis, peritonitis, gastritis. Duodenum is duodenitis, colon is colitis, peritoneum is peritonitis, and gastric stomach gastritis. So answer is peritonitis. When caring for a 3-day-old neonate who is receiving phototherapy to treat jaundice, the nurse in charge would expect to do which of the following? Turn the neonate every 6 hours, encourage the mother to discontinue breastfeeding, notify physician if skin becomes bronze in color, check the vitals every 2 to 4 hours. So in these options, what is the nurse in charge expected to do? Check the vitals every 2 to 4 hours. Mother is not supposed to encourage the mother to discontinue feed. She should not notify the physician if the skin becomes bronze color. When she is checking the vital signs every 2 to 4 hours, she is supposed to observe the changes in the baby. And turn the neonate every 6 hours nahi hota hai. We are supposed to turn the neonate every 2 to 3 hours. After birth of a baby, breastfeeding should be started within 2 hours, within half an hour, on second day and after a week. So breastfeeding should be started within half an hour of birth. The ratio of lung inflation of chest compression in cardiopulmonary resuscitation is 1:5, 2:5, 1:3 and 3:1. Here the answer is 1:3. Ratio of lung inflation of chest compression in cardiopulmonary resuscitation is 1:3. Which of the following condition has an increased risk of developing hyperkalemia? Which of the following condition has increased risk of developing hyperkalemia? Means increased potassium. Crohn's disease, Cushing's disease, chronic heart failure, or end stage renal disease. See here, the End stage renal disease is the risk of increasing hyperkalemia because the potassium is and urea creatinine are not eliminated through urine. A client with C4 spinal cord injury is at greatest risk of neurogenic shock, respiratory compromise, paralytic ileus, or stress ulcers. Respiratory compromise. The answer is respiratory compromise. Microorganism that is usually a part of normal vaginal flora but can cause meningitis in newborn is Corynebacterium species, Candida albicans, Group B Streptococci, Staphylococcus epidermidis. Here the answer is Group B Streptococci. A pregnant woman diagnosed severe anemia, the hemoglobin is 7 grams per deciliter, will be treated by advised to take food rich in iron and vitamin C, advised to take iron and folic acid tablet 1 OD for a month, and packed cell transfusion or administration of iron IM injection 1 OD for a month. So here we will suggest packed cell transfusion, whereas the other remedies are also given. But severe anemia has to be treated immediately. So the answer is packed cell transfusion. All are the clinical features of meningitis except knuckle rigidity, poor feeding, high pitch cry, and constipation. C, answer is constipation. The constipation is actually not the symptom or a clinical feature of meningitis. The knuckle rigidity means that neck is rigid, and poor feeding, the baby is not feeding, not taking feed. High pitch shrill cry, the baby will cry very high pitch and shrill because child is having that intracranial meningeal irritation, and that is why the child is crying, and the pitch or the cry she will be very shrill and the pitch will be very high. So here, which is not the feature, is the constipation. What should be immediate action in cases of severe bleeding? C, apply pressure to the wound, call for medical assistance, put a dressing over the wound, cover it with a pad of soft material. Here the answer is apply pressure to the wound. When there is a severe bleeding, apply pressure to the wound. Adrenaline dose in anaphylactic shock is 1:1000, 1:10,000, 1:1000, 1:10,000, and 0.5 ml, 0.5 ml, 1 ml, 1 ml. So here the answer is 1:1 in 1000, 0.5 ml. How many moments of hand hygiene have been laid down by WHO? That is the World Health Organization. 7, 8, 6, 5. Here the answer is there are 5 moments of hand hygiene. If you see, 1 before touching a patient, 2 before cleaning and antiseptic procedure, 3 after body fluid exposure risk, 4 after touching a patient, and after touching patient surrounding. That is 5. Thank you viewers. Like, subscribe and share.